So, you're getting ready for your preoperative visit and you're wondering, what can I expect? Well, your preoperative visit will be arranged usually 1 to 2 weeks before surgery, but sometimes if you're traveling up to a month before. At that visit, you'll spend at least an hour, sometimes an hour and a half in the office, and we will go over the entire surgical plan again in detail. You will spend some time with Nurse Mary, who's a different Mary in the office. Nurse Mary is a registered nurse, and she is just wonderful. You'll love her. All of our patients do. She will go over all the details of the procedure, all the potential risks and complications, and she'll make sure that she marks down any additional questions that you want to go over with me. Nurse Mary is also going to teach you about drains, if drains are going to be included with your surgery, which is usually a breast augmentation, some types of breast reconstruction, and an abdominoplasty. Now, don't be scared about drains. Drains are your friends, and drains are very important to decrease the risk of complications. So they will be a little bit more familiar after this visit, and when you have them, we will go over everything again in detail. At the preoperative visit, we will also give you prescriptions for after surgery. Although most plastic surgery procedures are not that painful, we always will give you a narcotic pain medication. Usually either a combination of a small amount of narcotic together with Tylenol, Vicodin or Percocet are the brand names, but some people have a lot of nausea with those medications, and so we do have a few alternatives that we can give you if you've had a bad experience with one of those medications before. We often give you a few days of antibiotics after surgery, and those antibiotics are just preventative to prevent against infection. We also give you an anti-anxiety medication, and we strongly encourage that everybody takes it, because having a plastic surgery procedure, of course, you're going to be nervous. So the medication that we give you, we insist that you take it the night before surgery. It will help you get to sleep. Just don't mix it with alcohol and don't take it and drive. And also, it can be very helpful the day of surgery. When you're in the car on the way to the hospital, you can take the anti-anxiety medication with just a teeny baby sip of water. That way, your stomach is still empty, but when you arrive at the hospital, you'll be calm, you'll be relaxed, your veins will be open, the IV will slide right in, and just everything will be easier. You'll still be with us, and if you don't feel comfortable taking a full dose, you can always cut the pill in half. At that visit, we will also go over your procedure in detail, and I will also spend some time with you. If we haven't taken photographs before, we will take photos at that time. The photos we take have no identifying features. They are only from the neck down or only the area in question. They do not end up on the internet. And if you ever have tattoos, rest assured, I have lots of patients who have tattoos, but I would never show your photos to anyone else, even if they're anonymous, because tattoos are potentially identifiable. And we honor your confidentiality above all else. At that visit, we will also draw on the photos. We will go over what your goals are in detail. And if it's a breast augmentation consultation or preoperative visit, then we will go over your wish pictures in detail. The pictures that I've asked for you to find that show me yes, what you do want, and no, what you don't want. So we are completely on the same page. We know what the plan is, and you will leave the office feeling a little nervous, which is normal, but really reassured that you have good communication with me and we know what we're doing going forward. Finally, at the preoperative visit, I give you my cell phone number. Now, many plastic surgeons don't do this, but I do. As I said before, I treat you as if you were my family member or my good friend, and I really want to be available to you 24/7. Text messaging is the easiest way to reach me. And I say, first time you contact me, let me know who it is, then I'll save your number in my phone. And no question is too silly or too small. I would only be upset if I found out that you had been losing sleep for a few nights over something that I could have either reassured you about right away or something that potentially is a concern and you've just been holding it inside. So please do text message me anytime, and I'd rather have an ongoing dialogue and answer questions as they come up both before surgery and after surgery. Finally, at your preoperative visit, you will finish off with Mary Pasache again, and she will review everything again, paperwork, any payments, and any other insurance information that needs taking care of. And then we're good to go. Surgery will be coming up soon after that.